Now, what exactly is a seizure? At its core, a seizure is a sudden, uncontrolled electrical disturbance in the brain. Think of it like a temporary short circuit in the brain's wiring. This can cause changes in your behavior, movements, feelings, and levels of consciousness. It's crucial to understand that seizures are a symptom, not a disease in themselves, though recurrent seizures often lead to a diagnosis of epilepsy. However, not everyone who has a seizure has epilepsy. They can be triggered by various factors like high fevers, head injuries, or certain medical conditions. We'll explore 5 distinct types today, each with its own unique characteristics and implications. Throughout this video, we'll aim to replace confusion with clarity and fear with understanding. Knowing the different types of seizures is incredibly important, not just for those who have epilepsy or their families, but for everyone. You never know when this knowledge might help you assist someone, or even just understand a colleague or friend better. We're building a community here focused on health literacy. And today we're taking a significant step forward in understanding a condition that affects millions worldwide. So, grab your thinking caps, maybe a notepad, and let's get into it. All right, let's start with what many people traditionally picture when they hear the word seizure, the tonic-clonic seizure, which you might have previously known as a grand mal seizure. These are generalized seizures, meaning they affect both sides of the brain from the onset, and they are characterized by 2 distinct phases. The first is the tonic phase, where all the muscles in the body suddenly stiffen. If the person is standing, they will fall, often quite suddenly and without warning. Sometimes a person might let out a cry or a groan at the beginning of this phase. This isn't a sign of pain, but rather air being forcefully expelled from the lungs as the chest muscles contract. Consciousness is lost during this phase, which typically lasts for about 10 to 20 seconds, though it can feel much longer to an observer. Following the tonic phase, we move into the clonic phase. This is where the body begins to jerk or convulse rhythmically. The arms and legs may thrash, and the jaw might clench. It's during this phase that there's a risk of biting the tongue or the inside of the cheek. Sometimes there can be a loss of bladder or bowel control due to the intense muscle contractions and loss of voluntary control. Breathing might be shallow or temporarily stop and then restart, and the person's skin might take on a bluish tinge, especially around the lips, due to a lack of oxygen. This phase usually lasts for less than 2 minutes, but again, in the moment, it can seem like an eternity. It's vital not to restrain the person or put anything in their mouth during this time. Once the jerking movements stop, the person enters what's called the post-ictal state. This is the recovery period immediately after the seizure. The individual will likely be very tired, confused, and disoriented. They might have a headache, feel nauseous, or have sore muscles. This period can last from several minutes to several hours. They won't remember the seizure itself. The most important thing during this time is to ensure their airway is clear, they're breathing okay, and they are allowed to rest in a safe, comfortable position, usually on their side. Understanding these phases helps us know what to expect and how to provide safe support. Next up, we have focal seizures, which were previously known as partial seizures. Unlike generalized seizures that involve the whole brain from the start, focal seizures begin in one specific area or network of cells on one side of the brain. Because they are localized, the symptoms can be incredibly varied, depending entirely on what part of the brain is affected and what functions that area controls. Think of it like this. If the seizure starts in the part of the brain controlling hand movement, you might see twitching in the hand. If it's in an area processing vision, you might experience visual disturbances. It's this variability that can sometimes make them tricky to recognize. Focal seizures are broadly divided into 2 main categories based on a person's awareness during the event. First, there are focal aware seizures, previously called simple partial seizures. During these, the person remains fully conscious and aware of what's happening, and they can usually remember the event afterward. The symptoms can be motor, like twitching, jerking, or stiffening of a limb or one side of the face. They can be sensory, causing strange sensations like tingling, numbness, seeing flashing lights, hearing buzzing sounds, or even experiencing unusual smells or tastes that aren't there. There can also be autonomic symptoms like a racing heart, sweating, or nausea, or even psychic symptoms like a sudden feeling of fear, anxiety, or déjà vu. Then we have focal impaired awareness seizures, formerly known as complex partial seizures. In these, the person's consciousness or awareness is affected. They might appear dazed, confused, or unresponsive, almost like they're in a trance. They may not be able to respond to questions or commands. A common feature of these seizures is the presence of automatisms, which are repetitive, purposeless movements. This could be things like lip smacking, chewing motions, fumbling with clothes, picking at objects, or even walking around aimlessly. The person won't remember the seizure or what happened during it. Sometimes a focal seizure can spread and evolve into a generalized seizure, like a tonic-clonic seizure. Now let's talk about atonic seizures, which are sometimes dramatically referred to as drop attacks or drop seizures. The word atonic literally means without tone, and that's precisely what happens here, a sudden and complete loss of muscle tone. This can affect all the muscles in the body or just a group of muscles like those in the head and neck. These seizures are typically very brief, often lasting only a few seconds, maybe up to 15 seconds. But their suddenness is what makes them particularly concerning. Imagine your muscles just instantly going limp. That's the essence of an atonic seizure. When an atonic seizure occurs, if it affects the postural muscles that keep us upright, the person will suddenly collapse or fall to the ground. If they are sitting, they might slump over. If only the neck muscles are affected, they might just experience a sudden head drop. Because the loss of muscle tone is so abrupt, there's a very high risk of injury, especially head injuries from the fall. Consciousness may be briefly impaired, or the person might remain aware but simply unable to control their body's sudden collapse. The recovery is usually quite quick once the seizure itself ends, but the potential for injury during the fall is the primary concern. These types of seizures can be quite frightening to witness due to their sudden and unexpected nature. Individuals who experience frequent atonic seizures often need to take precautions to protect themselves, such as wearing a protective helmet to prevent head injuries. Atonic seizures are often, though not exclusively, seen in children and can be part of specific epilepsy syndromes like Lennox-Gastaut syndrome. Understanding that this isn't clumsiness but a genuine seizure event is crucial for providing the right support and ensuring safety measures are in place. The key here is the abrupt, brief loss of all muscle strength. Let's move on to absence seizures, which you might have heard referred to as petit mal seizures in the past. These are a type of generalized seizure, meaning they involve the entire brain, but they look very different from the dramatic tonic-clonic seizures. Absence seizures are characterized by brief, sudden lapses of awareness or consciousness. The person suddenly stops all activity and stares blankly, as if they're daydreaming or lost in thought. These episodes are typically very short, usually lasting only about 5 to 15 seconds, though sometimes up to 30 seconds. Because they're so brief and subtle, they can often go unnoticed or be mistaken for inattentiveness, especially in children. During an absence seizure, the person is completely unaware of their surroundings and will not respond if you try to talk to them or touch them. They won't remember anything that happened during the seizure. There might be subtle motor signs like rapid eye blinking, slight fluttering of the eyelids, or minor chewing movements of the mouth. But often it's just a blank stare. As suddenly as the seizure starts, it stops, and the person typically resumes whatever they were doing right before it began, with no confusion or lingering effects. It's like a brief pause button was hit on their consciousness. While a single absence seizure might not seem like a big deal, they can occur many times a day, sometimes dozens or even hundreds of times. If this is happening, especially in a child, it can significantly impact their learning, concentration in school, and social interactions. Imagine trying to follow a lesson or a conversation when your awareness keeps cutting out for short periods. That's why early recognition and diagnosis are so important. An electroencephalogram or EEG, which records brain activity, is a key diagnostic tool as it can show a very characteristic pattern of brainwaves during an absence seizure. Finally, let's discuss myoclonic seizures. The term myo refers to muscle and clonus means to jerk. So these seizures are essentially sudden, brief, shock-like jerks or twitches of a muscle or a group of muscles. Think of that jolt you sometimes get as you're falling asleep, a hypnic jerk. Myoclonic seizures can feel somewhat similar, but they occur while awake and are due to abnormal brain activity. These jerks are very short, often lasting less than a second or two, but they can occur in clusters, with several jerks happening one after another. They can affect almost any part of the body, including the arms, legs, face, or even the entire torso. The nature of these jerks can vary. It might be a single, isolated twitch of an arm that causes someone to spill their drink or drop what they're holding. It could be a more forceful jerk of both arms or a sudden bending forward at the waist. Usually, the person remains fully conscious and aware during the myoclonic jerk itself, though if they have many in a row, it can be disorienting. Sometimes, myoclonic seizures can be a precursor to other types of generalized seizures, such as a tonic-clonic seizure, or they can occur as part of a mixed seizure disorder. Myoclonic seizures are a hallmark feature of certain epilepsy syndromes, most notably juvenile myoclonic epilepsy, JME, where they often occur shortly after waking up in the morning or after a period of sleep deprivation. While a single isolated myoclonic jerk might be minor and easily dismissed, frequent or strong jerks can be disruptive and increase the risk of falls or injuries, especially if they cause someone to lose their balance or drop things. Differentiating these from normal twitches or tics is important for accurate diagnosis and management, and again, an EEG can be very helpful in identifying the characteristic brainwave patterns associated with them. So there you have it, a rundown of 5 distinct types of seizures: tonic, clonic, focal, atonic, absence, and myoclonic. As you can see, seizures are far from a one-size-fits-all phenomenon. Each type has its own unique characteristics, symptoms, and implications. Understanding these differences is so incredibly vital. It helps us to recognize when someone might be having a seizure, to respond with appropriate first aid, and, importantly, to reduce the stigma and misunderstanding that can often surround epilepsy and seizure disorders. Knowledge truly is power when it comes to health. Remember, if you or someone you know is experiencing symptoms that you think might be seizures, it is absolutely essential to seek professional medical advice from a doctor or a neurologist. This video is designed to be informative and to raise awareness, but it is not and should never be a substitute for a thorough medical evaluation, diagnosis, and personalized treatment plan. Every individual situation is unique, and healthcare professionals are there to provide the tailored care that's needed. Don't hesitate to reach out to them with your concerns. Thanks for watching. If you found this video helpful, and I sincerely hope you did, please don't forget to give it a thumbs up. Subscribe to the channel for more health tips and deep dives into medical topics, and definitely hit that notification bell so you don't miss out on future content. Sharing this video can also help spread awareness and understanding